IV drug use can be extremely dangerous, and there's often a stigma around individuals who are struggling with this form of addiction. In this video, I'm going to talk about some of the dangers associated with IV drug use, and then I'm going to give you some resources to help you if you are struggling with this form of addiction. The first danger is transmission of infectious diseases, and this happens whenever you're sharing needles during IV drug use. And the infectious diseases I'm talking about are like hepatitis and HIV, which are easily transmitted through this route. These diseases usually require lifelong treatment, and you can unknowingly spread these diseases to others. Next is endocarditis, and this is where you actually get inflammation and infection inside your heart, specifically the heart valves. And this occurs when you inject with dirty needles, or you fail to disinfect the site, or you're using improper technique for compounding the drug, which should actually be done in a sterile environment. So whenever a person goes to inject in the vein, they're actually going to inject all of these germs into their venous system. And once in the venous system, it actually travels almost instantly to the heart. And as it goes through those chambers of the heart, it's going to come in contact with those heart valves, and those germs are just going to stick and congregate on those heart valves, leading to inflammation and infection. And I've actually seen these vegetation growths on heart valves while I've assisted cardiologists during a transesophageal echocardiogram, which is also known as a TEE. And these vegetation growths can be rather large. For instance, sometimes we would see them on certain valves of the heart, and they would literally be so large that you could just see them floating off of the heart valve, which is very dangerous because that vegetation can break off and enter the bloodstream and become embolized. Sometimes they can even go to the brain and cause a cerebral embolism. And really a big danger with endocarditis when it involves your heart valves is that you're going to have to undergo heart valve replacement surgery. So that's a big ordeal. And then you're going to have to be on anticoagulants for the rest of your life to keep your blood thin so you don't form like a clot on that newly replaced valve. And I remember one really tragic case is that I had this young patient maybe in their early 20s, and they had a heart valve replacement. They were still using IV drugs. They were needing another heart valve replacement, and they're on anticoagulants such as warfarin. And they weren't very compliant, so the INR got up really high, and they ended up dying of a brain bleed. So this is really serious stuff. Another danger is that it completely damages your veins. So what can happen is that scar tissue will build up over those veins, and those veins will become harder and harder to find. So patients will start looking at different ways to inject. They may start using the veins in the feet or even the neck, or they may even have to turn to the arterial route, which is extremely dangerous because you're dealing with arterial circulation, and you could potentially cause like a pseudoaneurysm. And really a big danger from using your veins over and over is that you could develop a DVT in your veins, known as a deep vein thrombosis. And these clots, along with infection, can lead to amputation of extremities as well. And I've actually taken care of patients who've been in their early 20s once again and have actually lost feet and hands because of this happening. And it can be extremely devastating for the patient and their family. And then finally, the last risk is overdose. And this can happen for many reasons. For instance, the drug may be laced with a potent substance. And I actually seen recently in the news that there was a problem with certain recreational drugs being laced with an animal tranquilizer, or the dose that the person is injecting is just too high. And this is where the person develops a tolerance to the medication. Therefore, they seek higher dosages, which greatly increases the risk of a fatal overdose. So if you or someone you know is using IV drugs, you want to be aware of these health concerns and not be afraid to get help. Because IV drug addiction happens to people of all walks of life, and there shouldn't be any shame in getting help. There are many healthcare professionals working in recovery centers who can help you overcome your addiction, and there are many success stories of people who have struggled with drug addiction, yet they have been able to get treatment and help and regain their life back. And there are plenty of resources available to help you with this. For instance, to find a treatment center, you can visit findtreatment.gov, or in addition, you can call a national helpline, and it's free, completely confidential, and they're available 24 hours a day, 365 days a year. And the number is 1-800-662-HELP.